Okay, so this is a demonstration on how to do a shoulder evaluation. So, Travis, what arm is injured?
My right arm.
Okay. Are you right or left-handed?
Right.
Okay, so it's important to recognize what dominant side is as well as the injury side. So talk a little bit about mechanism of injury. We want to know what the mechanism is. Is that onset gradual or acute? Where's your pain? Is it medial, lateral, anterior, posterior, deep, diffuse, just cover the whole shoulder joint? So do you have an answer for that?
All of it.
All of it?
Yeah.
Okay. So when we talk about pain, we want to know, is it constant? Is it frequent or just occasional? Aggravating factors. So with a shoulder injury, oftentimes we have, we're bothered by activities of daily living, such as putting on a coat. So we'll ask them, does that bother you to put on a coat? How about sleeping on that side? How about combing or washing your hair? Reaching up on a high shelf, does that bother you? Throwing a ball overhand, or lifting heavy objects. A lot of times people with shoulder injuries will have issues with those. Symptoms we're looking for: pain, clicking, popping, snapping, instability, giving out, weakness or numbness, and then they've had any previous injuries or surgeries. With observation, we're looking for discoloration, deformity. So we're going to compare bilaterally, both sides. If they have a tank top or a sports bra, that's ideal. So we're looking on that, but we're also looking on the scapula area as well as the pec area. Do we have any swelling or effusion happening? Any abrasions or muscle wasting where we have muscle atrophy due to some chronic injury? So with palpation, then what we're going to do is we're going to feel for tenderness, deformities, temperature changes, muscle spasms, crepitus, or numbness of the following areas. So we're going to palpate on the clavicle. Does that bother you there at all? Okay. We're going to check the AC joint up on the top. Does that bother you at all there? Humerus. Anything bother you here? Okay. SC joint right down here where the clavicle attaches. Pain there. And then go ahead and turn around for me. And the scapula as well. Any pain with the scapula, any pain with the scapula on that side. Okay. And then we get to soft tissue. Turn back around. So with soft tissue injuries, we're going to look at biceps. So any pain on your biceps? I'm kind of comparing both sides. Okay. Pain on the triceps on the back side. Any pain of pecs on the front with palpation. Any pain with deltoids on the sides? There. Any pain with the traps up in here? And lats underneath. Go ahead and lift your arms up for me. Go ahead and turn around. Easier. So our lats go from here all the way down on each side. All right. Now for special tests, we're going to note whether or not it's positive or negative, but also is there difference in range of motion? Is it normal? Is it lax, meaning there's laxity to it, or is it weak? So first thing we're going to look at is shoulder swelling. Is it obvious? So we're going to look at them and tell, do we notice a burst of swelling? Do we notice some type of abrasion swelling, something like that? Shoulder range of motion. When we do range of motion, we want to do all motions of it. We can do this through the Apley scratch test, or you can go through each motion independently. So Apley scratch test is go ahead and come forward with your arms all the way up. We're just looking at shoulder flexion. Come back for me for full extension. Good. Now we're going to go ahead and turn around for me. We're going to go ahead and do scratch down on our back. That's for external rotation on both sides. We're going to note where it is. So maybe it makes it a T3 on his left. Go and do your right again. And about the same, T3 on the right. Now go into internal rotation. Come up the back. On his left, we're up to about C7. It's that bump right there in your neck. And do it on your right. And we're about T6 or 7 on that side. So definitely significant on that side. Last one we're going to do is scratch your shoulder. So see what we get to. We kind of note where it is. So we can get all the way to his spine on his left. Do your right for me. And he can get to the spine of his scapula. So only to his scapula there. So that's the Apley scratch test to be able to check for range of motion. For strength test, then what we're going to do, go and stand this way for me. We're going to go ahead and do internal and external rotation. So don't let me push your arms in. Good, don't let me push them out. So this is for external rotation. Pushing in like this is for, pushing in, go and resist against it is for external rotation strength. Pushing this way is for internal rotation strength. Pulling forward is for flexion strength. And pushing backwards is for extension strength of his triceps. So we can now go out like this. So adduction, abduction. So pushing down is for abduction. pulling up for adduction. And then we can also do internal and external rotation. So from here, this checks for teres minor. So I can push down the hands. Good. Good extension. Good. Just like that. So when we look at strength, that's what we're getting for adduction, abduction, internal, external rotation, flexion, and extension. Now, special tests. Drop arm test. So go ahead and lift your arms up for me. This tests for just rotator cuff strength. Go ahead and slowly come down. Lower it down nice and slow. What we're looking for is a drop on that injured side. If that's the case, then it's positive for rotator cuff strength. Now, specifically, if we wanted to test the supraspinatus, we're going to do the empty can test, where, go ahead and turn a little bit sideways like this, about 30 degrees out here, thumbs down, isolate that supraspinatus, push down, and don't let me push it down for you. Okay, good. If it's positive, it's going to go right down like that. Supraspinatus. Hawkins-Kennedy test is for impingement. So get internal rotation, like this, and now come across the body. We do that. Positive for impingement would be if that causes pain. Does that cause you any pain? So he has good range of motion. We'll check the other side as well. So internal rotation, and then coming across. Wing scapula test. Go turn around and do it on this. With the wing scapula test, what we're looking for is scapular winging. And that happens because we get impingement of the long thoracic nerve that comes from our shoulder and comes down to our serratus anterior muscles. If that nerve is impinged, those muscles get weak and it allows us to lift up. So let's go ahead and see if you have any impingement of the shoulder. So go ahead and do a push-up against the wall. When we do that, we're looking for scapular winging. I got my fingers underneath either side, and I can't on him, so he has no scapular winging. That's negative. Sulcus test. That is to tell for glenohumeral instability if we have a sprain of the ligaments that hold the glenohumeral joint together. So I'm just going to pull down, and what I'm looking for is kind of flattening of the deltoid. And you can see on Travis when I do that, his deltoid is still rounded, so that's negative for the sulcus test. Apprehension test. We do that for rotator cuff, possible shoulder dislocations. We get into external rotation. We look at his face when we're doing it, and is he apprehensive at all? So if they've had a recent dislocation or subluxation, when I put them in this position, they're going to be really apprehensive and not let me do it. AC sprain test. We do two of them for it. One is the piano key sign. I can push down his clavicle right here, and if it was positive, this would pop back up. Or I can just go across like this, and that'll load that AC joint, and that'll cause pain. Speeds test is for bicipital tendonitis. I got to find the biceps tendon. It's right here. I'm going to rotate a little bit to find it. Relax for me. I can feel it rolling in there. So bend it about 30 degrees. Okay, or actually more about 60. And then go ahead and lift up with your arm. Don't bend your elbow, just kind of where the whole arm comes up. And I do resistance against it. And if that causes pain right there, it's positive for bicipital tendonitis. It's called the Speeds test. And the last one is the percussion test for any type of fracture. So if we suspect a fracture of the clavicle, which is right here, just tapping on it, if that causes any pain. Or the scapula, normally the scapular spine, right here on the back. If we tap on that, that causes pain. So based on that, what do we think our diagnosis is? And then coming up with a treatment plan.